Well, all this week on the program, we have been hearing concerns about violent incidents and long wait times for patients in emergency rooms. On Monday, we heard from a doctor who filed a lawsuit claiming her job was threatened after she put up a sign warning patients of ER delays at Eagle Ridge Hospital. We also heard from the president of Doctors of BC. Dr. Charlene Louis says it can be challenging for doctors to feel heard.
There can be some repercussions sometimes, or some psychologically unsafe environments where doctors may feel unable to raise the concerns. Sometimes it feels like they are not being heard.
And we also heard from patients about some of these conditions. Angie Dubé attended the ER at Royal Columbian Hospital. Here's what she told us about her experience.
I'm stuck in this plastic chair with no way to be comfortable for 17 hours. Our system is so broken. They couldn't tell if my legs were swollen because of the medical condition that I was experiencing, or if it was because I had been sitting there for so long.
Throughout the week, we have heard calls for more resources and better conditions. So we are now joined by the Health Minister, Josie Osborne. Good morning.
Good morning. Thanks for having me here.
We're glad that you are able to talk through some of this with us. The patient we just heard from there waited 17 hours at Royal Columbian. Why are wait times so long?
Well, first of all, I listened to Angie's interview and I completely feel for her. And I know I've heard from many people myself too. It's so stressful to have to wait for so long, whether you're the patient or you're a family member. Maybe you brought your mom or your dad into the ER. You've got to wait a long time, sit in a chair, perhaps, like Angie described. That's unsettling for most at best, but it is something that's really impacting people. And we are seeing a growing number of ER visits. We have a growing and aging population here in British Columbia, and it has, combined with a global healthcare shortage, made things very strained.
So how do you fix it? How do you fix it?
Well, that's why it's really important that we take both short-term and long-term actions. But first of all, I do want to assure all the listeners that the most urgent patients are always seen first. So motor vehicle accidents, cardiac arrests, incidents like that. And sometimes that does mean that other patients have to wait longer. And that is a hard thing to do. But I want people to know the most urgent patients, people are triaged, and people who need the most critical care are seen right away. But again, we're taking short-term and long-term actions to try to address all of this. And it's not just about hiring more healthcare workers, although that's obviously part of it. It's also about building more facilities. So we are expanding or building 30 new hospitals right now. So that's adding ER rooms. For example, Surrey, a fast-growing community, building a new hospital in Surrey that will add an entire new emergency department. I was just recently in Fort St. James, a small town that for the first time has a real hospital. It has a real emergency room with a trauma bay. These are the kinds of facilities that we need to serve people. But then we need more people working in them too. We need more physicians, we need more nurses, and we are hiring and training more people here in British Columbia so that we can reduce these wait times and build out the staffs that we need.
It must be a challenging environment, though, to hire people, and I'll ask you more about that in a second, when these are the kinds of conditions that we are learning about coming from inside some of these hospitals. One of the other things, Minister, that came out in this lawsuit is that doctors say that they can't speak to patients and the public about these conditions. Do you think doctors should be able to speak publicly about what they see and the challenges they face?
Well, I think it is critically important that every staff person, physician, nurse, healthcare worker of any kind feels that they can express their concerns about their workplace and have them heard. It is vitally important. People bring forward those concerns because they are so dedicated and committed to giving the best, highest quality care for people, and they need and deserve to have the workplace conditions that are supporting them to be able to do that. It's so important that those lines of communication are there, that people are heard and listened to. And while I know you understand that I cannot comment on this specific lawsuit, in this specific case, I am deeply committed to making sure that health authorities and all employers are doing and using the appropriate channels and ways of being able to have that dialogue and really listening to the people who are working in healthcare facilities.
That's what you're saying as the Minister of Health, yet at the same time, we hear doctors of BC say that physicians feel that they can face repercussions for speaking out about these concerns. Is that acceptable?
No, it's not acceptable for people to feel that way. I want every single physician, every single healthcare worker to feel that they can have their voice heard. We're undertaking a health authority review right now. We've started with the Provincial Health Services Authority, for example. We have heard from over 6,000 employees through that review process, hearing lots of ideas specific to the review, but again, providing that channel, that place for people to be heard. But concerns about workplaces, concerns about employment conditions, they need to be heard and treated in the appropriate channels with processes that have integrity and that the due diligence is taken. And I know I've spoken to Dr. Louie personally about this to express my commitment to ensure that that's exactly what is happening. We have to hear from people on the front lines. That's why we're giving so much voice to frontline workers through the health authority reviews, because they have the practical, hands-on, day-to-day, in the trenches experience, and those voices have to be heard.
I know you cannot speak about the specifics of the lawsuit, but I do want to point out the safety that she has raised here, specifically that a patient threatened staff with a machete. Another patient kicked a nurse and broke 4 of her ribs. We have also heard in news stories several other incidents of violence in the ER. In fact, back in March, RCMP responded to an assault with a weapon against a nurse at Langley Memorial Hospital. Can you understand why we're hearing from doctors and patients right now who say that the conditions in these emergency rooms are unsafe?
Yeah, absolutely. It is entirely unacceptable to see these kinds of violent incidents taking place. People who work in hospital facilities, patients, their family members, their visitors, everybody needs to feel safe to be safe. And I take this very, very seriously.
So what should happen when someone brings a weapon into a hospital?
Well, first of all, we have been working in particular with the BC Nurses Union, and we've placed relational security officers, these are security professionals with specific training in high-risk emergency rooms throughout and hospitals throughout British Columbia. We are also working to, there's one facility here in BC already that's using weapons detection technology, but we're investigating AI technologies that can be used to help screen for weapons. I mean, weapons have no places in hospitals and they're not allowed, but I understand this is what's happening. And so we have to take action. That's why we're looking into this kind of technology to ensure, again, that this is not happening and that this is dealt with effectively. It's so important that hospitals, that healthcare facilities are safe places for people to work. Another action that we're taking is working through to the minimum nurse to patient ratio commitments that we've made so that nurses feel safer and they are safer workplaces, because nurses they should never be working alone. And so we're making, through that, adding nurses into emergency rooms to make sure that, again, whether you're a visitor or you're a patient yourself, that we're helping to reduce those potentially violent situations.
You mentioned earlier that one of the ways to reduce the wait times in these emergency rooms is to hire more doctors, increase staff. One of the efforts your government is doing to do that is advertising targeted at U.S. doctors. Here's how the BC government is pitching the healthcare system here. I think we have a bit of that advertisement.
It's a place with welcoming communities full of opportunity and a universal healthcare system that puts people first. To live where quality of care meets quality of life, follow your heart to British Columbia, Canada.
How hard is it to recruit people to come here to work in hospitals when they are so busy and arguably physicians are saying unsafe?
Well, this is why we have to take these kinds of short-term actions. Now is such a perfect opportunity to advertise to US-based healthcare workers and tell them about British Columbia's healthcare system. We do have an extraordinary system here, a public universal system, single payer, which is a big attraction to a lot of American physicians, for example. Coming in here, living in our incredible communities here in BC, a place to raise your family and to work, and to continue to work with us through the health authorities, through the Ministry of Health, and all of these actions that we have to take to build out more resilience in our healthcare system, to build safer workplaces in our healthcare system. But again, this all boils down to the people who work here, the people who are so dedicated and so committed. That's why we're inviting American physicians and nurses to join our teams, and that we're going to continue as government to take these actions to reduce workplace violence, to increase the staffing in hospitals, and to deliver the care that British Columbians expect and need and deserve.
But all of these conditions, Minister, are leading to burnout. We have heard these doctors complain that this lack of resources makes it tough to be motivated to work.
And my heart goes out to them because it is a very stressful time right now. And I understand that. There's a lot of strain on our healthcare system. We are in a global healthcare worker shortage. We are seeing a growing and aging population. That's why we're building more hospitals. That's why we're taking all of these steps to build a new medical school, to bring in more healthcare workers from other provinces or other countries like the US, to continue to build new urgent care centers, to decant some of that pressure off of emergency rooms, and build better workplaces for everybody. We have to do this work. We have to continue to do this. We're deeply committed to doing that work. There are short-term actions that are starting to result in some positive changes, but we know we have to stick to this. We have to stick to this for the long term because our population is getting bigger.
And before we let you go, I do want to ask you about the story that is in the news this morning. On May 26th, the pediatric ward at Kelowna General Hospital was closed by Interior Health. They say that is because of severe physician shortage. ER doctors, nurses, and pediatricians are all criticizing this. They say long-standing calls for more support have gone unanswered. It all seems tied together. How will you resolve this specific issue in Kelowna?
Well, yeah, I recognize the concerns that are being expressed, and I want to let everybody know too that I take these very seriously. Our priority is patient safety as well as safe and respectful workplaces. Kelowna General Hospital obviously is no exception. Again, we're seeing a lot of strain from a healthcare worker shortage, our growing and aging population, and Kelowna General Hospital. The very difficult decision was taken to close the pediatric unit for 6 weeks, while more pediatricians are coming online this summer to relieve some of that pressure. So we will continue to hear and listen. I know that Interior Health is meeting with healthcare workers, meeting with physicians, including today, for example, to work through these issues. And that's the appropriate place for that work to happen.
Thank you for your time this morning, Minister.
Thanks for having me.
Josie Osborne is BC's Health Minister.